exercise portion for this lower quarter case. We're gonna start with prone press-ups for the patient, since we worked on extension and gaining some of that for standing and walking. And this would technically be a therapeutic exercise since we're laying down for this. I'll probably have the patient do at least 10 of these every hour, and at home for best results. So I'm gonna have you press up just as far as you feel comfortable going. You don't need to push through pain or stiffness, okay? So I'm gonna have you press up and back down. Good. Good, I monitor how we're doing. Try to make sure we relax the legs and the back to get a little bit more of that range of motion without muscle guarding. Good. So we would do a full 10. Good, relax down. And then after that, we're gonna try to stand on up and do it in standing as well as our second exercise. Let me have you come on up, standing. And I'll have you face the window. Good. So now in standing, get the hands on the hips, and we're gonna just do some more extensions to improve weight-bearing extension now. So I'm gonna have you lean back. Good. And again, we're gonna try at least 10 of these, doing them at home every hour if we can, to try to reduce and keep the inflammation and swelling down to a minimum. Good. All right, then the next one, because we did a little bit of down glide and rotation, I would like to keep some of that. So I'm going to, in standing, but also the patient could do it kind of sitting or leaning against the table here. I'll have you just kind of lean on the table there. I'm gonna have you cross your arms, and I'm gonna have you rotate to the left there. Now, with a little bit of flexion, we're kind of accommodating any of the swelling that's in there, but also trying to reduce through some of the rotation that we had also worked on in side lying, and I'll have you do about 10 of those as well. And these would follow your repeated extensions in standing at home. Good. And then the last thing, to get a little bit of neuro re-education into the body muscle activation, is some resisted rotation. Now again, we're gonna go light because we're just starting to get activation for this patient so that they can start to stand a little bit better and move a little bit easier with less pain. So all I'm gonna have you do is keep the band close to your chest and rotate, but actually I'm gonna have you do left rotation because that's the one that we're trying to improve. And actually I'll have you do 10 here, and then we could always add maybe even eccentric left rotation. A little bit of that resistance there. So let me have you face that way first. And I'll just have you rotate your chest. Good. And we would probably do 10 of these at least, maybe 2 sets, building up as to what's tolerable, comfortable, going up to 15 or even 20, or as many as the patient can tolerate, or what feels good, really. Good, maybe turn around, let's try the other one as well, where you're starting here and then you're turning that way a little bit, letting the band pull. Good. Again, same thing, starting with 10, building up to 15 and 20 as he feels comfortable and can move more. Good. Perfect. All right, that concludes our exercise portion.